Hello, everyone. Welcome to the Luke Branquinho Show.
You talked a little about the cold showers, and it's a little tough to do the very first time, and it's people think you must be nuts. My wife still thinks I'm crazy.
Hey, hit that subscribe button now. You're going to like it. Welcome to the Luke Branquinho Show. My next guest is not only a friend, but he is a doctor of internal medicine. And correct me if I'm wrong, Lonnie, that is your profession, but you also take care of us rodeo cowboys.
That is correct. I've been doing it for almost over 20 years now.
I honestly attribute one of my world championships to your help, because I'm sure you remember I came in and I couldn't hardly move. I was sick as a dog going into the 10th round of the national finals.
I do remember that. I remember looking at you in that corner going, boy, I don't know how he's going to ride tonight. He looks like, yeah. So it was you look pretty rough.
Yeah, and you gave me your little concoction, and I'm sure we're allowed to talk about it and tell everybody what it is.
So we kind of gave you, I'm not a real fan of narcotics. I guess that's one of the things I really like about rodeo athletes is a general rule. These guys don't want to ride where they're impaired. And so I came up with this cocktail with a drug called tramadol. Everybody knows this drug. It's been around for quite a few years. Back in 2011, it was a non-restricted drug. That didn't change until 2012, which means you didn't have to have a prescribing license for drug enforcement. It was a drug that was not enforced what we call by schedule. It wasn't a scheduled drug. And we added that cocktail with, we had ibuprofen and Tylenol. And I did a lecture on this a few years after we started using this protocol at the sports medicine program during the national finals. And it really is an interesting concoction because there's kind of five components that help treat pain as well as inflammation. And yet you're not overwhelming one system. The problem with many drugs is that they affect both the kidney and the liver. And technically, Tylenol can affect the liver. The ibuprofen can affect the kidney, and the pain control from tramadol is a different mechanism. It's a unique mechanism, but it doesn't give you a euphoria. It just gets rid of pain. So when we put that cocktail together, it's very effective in helping treat, especially athletes who are injured or even individuals who are injured for whatever reason. I've used the cocktail in the hospital on many occasions because people don't want kind of the side effects of some of the other drugs that are the heavy narcotics, and yet they get the relief they need without the pain. And I don't have to worry about their liver function and their renal function. So it's for me, it was kind of a mixed blessing to have it available. Unfortunately, they made it a scheduled drug in 2012, so it's a little harder to use, even though the addiction potential is significantly lower than other narcotic medications.
Well, and I know you've helped I'm not the only one, but lots of cowboys out with that concoction, and cowgirls. I know, like for me, I was coming in, you gave it to me, and I laid down half hour. I fell asleep in the corner for 30 minutes. And when I woke up, I was ready to roll. And to be able to have that without the euphoria or the chance of getting addicted to something is huge. And being at the national finals, you see people come in with the flu or with cold, or This year I think was probably one of the worst years of sickness, and you treated a lot of folks with it.
Yeah, this year I was pretty busy during the national finals. I was busy with some of the cowboys, bareback riders. They got pretty beat up, and so we had quite a few athletes that got treated. But we also had a lot of families that were also sick. It was just a rough year for kind of what was going around. It wasn't COVID, but unfortunately this year we had a lot of flu's going around, and it put a lot of people down. And unfortunately, I think you kind of touched on it just for a second, but 10 days. I mean, I don't think people realize what happens during the national finals. But you start out pretty stinking healthy on day one, but by day 10, you are bloody well beat up. And so I've had the opportunity over the last 20 something years is to see how we keep athletes healthy for 10 days. It's not like it's a Super Bowl of rodeo for one night. It's a Super Bowl of rodeo for 10 nights.
Yeah, and that's one reason why I and so many other cowboys love the Justin Sports Medicine program and what you as a doctor yourself do for us. And, I know you've been treating cowboys for so many years, and we've had this conversation of you don't want to treat people for the injury. You want to treat them prior to getting sick or prior to that. And that's going to lead me into my next thing, the stem cell research you were doing with with Dr. Roddy McGee, and I listened to Roddy's podcast with Joe Rogan, and I mean, it was mind blowing. That's really what I want to dig into today.
It's interesting because I've known Roddy for years. In fact, I was one that got him kind of interested in rodeo, and he's an athlete in his own rights. I don't know, people don't know about Roddy, but Roddy was a pitcher in baseball, and he played at the University of Utah. I mean, the guy's an amazing athlete on top of the fact that he's a great orthopedic surgeon. He does a lot of sports medicine stuff, but he and I kind of went down this pathway of looking for therapeutics that would help people, not necessarily just get them through the next step or had another pill. We were like, what we got to do what can we do to make a difference? Unfortunately, my dad had severe Parkinson's disease. He had some other issues, health issues. Unfortunately, he passed away in 2017, but I started about the same time Roddy did, looking for alternatives. And I had started looking into kind of where the world of regenerative medicine was going. I didn't jump on board because that was the newest. It's kind of the newest, kick. Let's all get involved. I had gotten involved to try and see I wasn't a fad. It was more or less, we've got to have alternatives that are going to change how we practice medicine. And I'll kind of tell you how we got through that. But it's interesting that Roddy was doing the same thing. Unfortunately, his dad had severe lung disease, and he was looking for alternatives to help his dad. And this is how he got into this kind of regenerative medicine. We both started independently, and now we're helping each other with how we're moving forward with the process of identifying these therapeutic options that are significantly more, they're safe, and I think they offer so much more with regard to avoiding some of the surgical interventions that may need to be done. That doesn't mean they may not require them, but maybe we give some time frame that's 5 or 10 years longer before they have to have a major surgery. So I think there's lots of opportunities to kind of adjust how we practice medicine. So I can tell you that I don't know if we talked about this before. I think I talked a little bit about it before, but I became really interested in where regenerative medicine was going after I read about the Nobel Prize winner in 2012, and that was Shinya Yamanaka. You can look him up, but there's a big PBS, or maybe it was his BBC study or a BBC show that talks about his life. Interesting enough, Dr. Yamanaka is also an orthopedic surgeon who also kind of went down the same pathway, looking to see how he could have helped his father. His father, unfortunately, died of hepatitis C, and I'm not divulging anything because that's on the PBS special. But it's interesting that we kind of all got into this looking to see, there's somebody that we affected us personally that we decided we've got to find some alternatives. So I have to tell you right now, I think that regenerative medicine, or at least these components of medicine, are going to change. It's going to change everything we know about medicine. I mean, this whole thing about the vaccine technically was derived at trying to change genetic coding. The vaccine is designed to do this concept. I don't necessarily know if it's the healthiest thing in the world. I think time will tell where this is going to go. I think there's some risk because it's so new. But if people don't realize it, I think the audience needs to understand that the future of medicine won't be based on a pill. It'll be based on what we can do genetically or cellular, at the cellular level to help people in general.
Well, and before we really started talking about this, I was going down to Mexico, to Tijuana, to Dr. Calzada's, and getting stem cell injections. And they had a clinic down there. They did cleanses and lymphatic massages. They did what is it called, chelation therapy, and it was like a 3 or 4 day deal. And then I was going down post surgery, and I'm like, I need some stem cells to hopefully help this heal better. And I didn't know if it was going to work or not, but I can tell you one thing, I sure felt better after I got that stuff done. Now, and that's not even the type of stem cells we're talking about. I think that was blue shark stem cells. You're taking it to the next level with the research and what you guys are proposing. So, I mean, in the United States, the stem cells that are being done generally inside the U.S., therapies are being done from the deposition of fat deposition on the individual who's going to have their stem cells. They're going to take the stem cells out of their fat and then isolate them out of the fat and then re-inject them, usually into a joint. So it's an autologous use of their own stem cells. The interesting thing about stem cells is that we all have them, and we make stem cells. This is probably why rodeo athletes do really well when they're young, because you generate a lot of stem cells up till about mid-20s. And every time you have an injury, your body's regenerating your own independent stem cells. And as we get older, that regenerative process becomes less and less, and it's a logarithmic, which after
I mean, it drops precipitously after age 30, 35 to 40. And that's when you start noticing, like, man, I used to do this, whatever, and now it takes me 3 days to get over it. And I think
Right.
that's the part that we're trying to say, look, there's alternatives. And a lot of the stuff we're studying now is really related to perinatal tissue that's acquired after a baby's delivery, and it usually most of it's coming from the umbilical cord stem cells, and that's because that's the easiest and probably the most effective way to isolate these stem cells. And so there's so much that's going to change in the next probably 5 to 7 years. The FDA, of course, regulates how these labs set up their recovery. We're not manufacturing anything. It's really just recovering these stem cells from perinatal tissue. In fact, if you said, well, are you a biologic company or whatever? It's like, yeah, we are a company, but we're not making anything. We're just recovering anything. We're recovering these cells. And so that puts us in a whole new world, because I'm not creating any waste. In fact, I'm taking the waste products and using those waste products. And it's interesting because the stem cell world has changed because of the concepts identified by multiple individuals. And there's a lot of athletes. It's not just rodeo athletes who are looking into what can they do to help improve their performance, but not necessarily the performance, but their function as they age, especially the athletes that are trying to keep moving forward in a very competitive arena.
Well, and for me, I'm past the stage of trying to be competitive in the arena, other than maybe team roping. But you, as well as anybody, know I'm a diabetic, type 1. I want to try to figure out a path, obviously eat, take my insulin, take care of myself, but is there another path to regenerative medicine with stem cells that will help me live a longer, more normal life where I don't, develop neuropathy or glaucoma or vision issues? So that's why I'm as interested in it as I am.
Yeah, and I have to say that's probably one of the funnest parts of what I do with rodeo, is the athletes and their families, as a general rule, are trying to find out what can they do to kind of prevent their disease from either progressing or prevent disease from starting. Now, unfortunately, yours is a type 1 diabetic. It had nothing to do with you. It's just an antibody response when you were a baby. However, I think in the future, we can identify how we can change that genetic code. Can we prevent young individuals from developing type 1 diabetes? And there's so many opportunities there. The question is what can we do now for those who are either type 1 diabetics or type 2 diabetics? The best thing we can do is help them live a fuller life. There's no reason in the United States we should have a lower mortality than the rest of the world. And unfortunately, in 2016, 17, and 18, our mortality went down. We didn't improve our mortality. We started dying younger. There really isn't a reason for that. I mean, there was a connection to opiate use and suicide that played along with that number. But what I'm really looking forward to doing is I'm kind of moving myself out of the hospital system, and I'm looking to move forward into this longevity arena, not because I wanted to preserve my own age, but I think there's an effective way to help patients or people in general move forward. There's so many advances in medicine now that keep moving forward, but one of the things we need to do is you have to get up and move, you have to exercise, you have to make a change in your diet, you have to make changes that sometimes are quite uncomfortable, but if you do that, it's probably the easiest thing we can do to help you move forward. If you're I've had maybe a handful of type 2 diabetics that are adult onset that we initially get them diagnosed, and what we try to do is, like, the best way for you to get ahead of this is to lose weight and exercise and diet. And now those are the things that doctors always tell you, but I've had probably a handful who have done that. And one of the guys I took care of is probably 18, 20 years ago, was in Kentucky. And the guy, he wasn't really keen on what we were doing, but I explained to him that if you don't want to be a full-fledged diabetic, you need to change. And it was interesting, within 2 months he came back, he had lost like 30 pounds. He started exercising, he started eating right, and his hemoglobin A1C, which is that marker that everybody looks at for your control, his hemoglobin C went below 6 in 3 months or 2 months, which means he had started kind of doing what we asked him to do right off the bat. After I talked to him, he had made those changes. And so I became much more convinced the best way I can help patients is to get them to understand that we make these changes, your life gets significantly better. People put all their money away, and this is kind of my push, is people put money away in their 401k waiting to spend it. But if you're unhealthy, putting that money away, you hit retirement and then you live for a year and your kids get to spend your money. I mean, because you really haven't really protected yourself or allowed yourself to enjoy it, because your health it's kind of been compromised. So we need to change that.
Well, when I called you to talk about the show, and I call you all the time. My kid's sick, or I need medical advice. You talk to you about me trying to change my habits, and I'm down 15 pounds from the first of the year. I've been taking the cold showers like you recommended. I've been in control for the last 2 weeks, like 100%. I've been anywhere from 140 to 80. Not dipping low, not going high. Granted, I changed eating habits, but I cut my insulin down to a half of what I used to use, and it's amazing how much better I feel now than I did 3 weeks ago. But using this stem cell therapy to enhance my life even more is something I'm looking forward to. And I know you said you're trying to get out of the hospital. You and Roddy, I believe, are trying to open a couple clinics up to get this started.
Yeah. So we're looking to put a clinic here in Vegas, and then I'm also looking to put a clinic in Texas. I have a Texas here. I have a license in Texas and Nevada as well as Idaho. So I've been working in hospitals here in Nevada and in Idaho, but we are looking forward to doing this other pathway to kind of health. And that's because I think there's so many people we can help. The best thing you can do for your own health care or your own health is just to prevent developing disease. And I think you talked a little bit about the cold showers, and it's a little tough to do the very first time. And people think you must be nuts. My wife still thinks I'm crazy, but it's amazing when you get that epinephrine, surge, and then you kind of get the next 3 to 4 hours of dopamine kind of release. Your focus gets better, everything gets better, even your diet improves, because you're like, well, I'm not starving like I was before I did this. It's so many things seem to improve with that concept. The whole thing, I think we talked a little bit about the sauna, the hot sauna.
Yep.
There's so much data coming out of out of other arenas, and there's some great podcasts. There's one from the Huberman Labs. If you look him up, he's got some great information out there on the ways to kind of adjust your lifestyle to improve your overall outcome. And I think that for me, it's the funnest medicine I've ever practiced. I mean, I'm an internist, so by trade, our job is to just, keep medicines moving. That's what we do. We keep adding drugs to your regimen. And I mean, without a stretch of the imagination, I had patients who were on 12 to 13 or 15 drugs all the time. And I'm like, were we changing their outcome? Maybe, and I may have changed a few things, but I think the overall improvement would have been much better if I'd have got them to change their behavior, 5 or 6 years earlier. That we had them, I probably would have them maybe on 3 or 4 drugs rather than 15.
Well, and speaking of changing that behavior, you put me onto a show on Netflix with Chris Hemsworth. Both his parents have dementia, correct? Or
no, they had the genetic predisposition to develop dementia, unfortunately. So he's at much higher risk because he's got both parents. And it wasn't on Netflix. I think it was on Disney Plus. It's a
Disney Plus. That's right. Yes.
Yeah, it's a National Geographic show, and it's truly inspiring, because I've been talking about this same concept with my family for the last year and a half, and they kept thinking I was nuts. But if Chris Hemsworth does it, then you must be okay.
Yeah.
So
well, that's Thor. So I mean, Thor does it.
Yeah. Then the rest of the world can do it. Yeah.
But just changing those patterns in your young age or at any age, changing those patterns to help change the patterns of the future that could cause problems.
Absolutely. And I think, if I could give any advice to anybody right now, there's probably some things that it won't cost you anything. I mean, if you're over the age of 40, you need to try and walk 2 miles a day. That's a 30-minute walk if you do a 15-minute mile. And a 15-minute mile seems like it's not a big deal. But if you haven't walked in a while, try a 15-minute mile. It's a little tough. And if you can get to 15-minute mile and you can do that, 5 or 6 days a week, the improvements you will see in just everything, your overall outlook, how you sleep at night, all those things will change. That's one. And the other one is, like I said, take the cold shower. Take a 3-minute cold shower after you end your shower 3 times a week, a Monday, Wednesday, Friday type thing, or Tuesday, Thursday, Saturday, whatever, floats your boat. But it's a little uncomfortable, but it's amazing how much, like I said, better you do focus-wise once you go through it. If you think you've got a heart condition, you may want to ask your physician before you go out and do something like that. But it's, for most of us in general, it's not hard to do. Just suck it up and like I said, cowboy up, and if you can, the challenge has always been try not to scream when you get turn that cold water on.
Well, I screamed the first time Lindsay came in, thinking I was fell and hit my head or something. But to see how the stem cells, even with doctors, and Dr. Tandy's fixed me multiple times, and I asked him this 10 years ago, "Hey, are stem cells beneficial?" No, there's no proof, no evidence. Now he's starting to kind of get into where, yes, we see some benefits, but he's still kind of on the outside. We don't know where they're going to head.
Yeah, and I understand Tandy's view of the world, and I think we're kind of the same in a different pattern. I mean, as a scientist, and this is not as a physician, but as a scientist, I'm always skeptical of everything. And if you're not skeptical, then you're probably in the wrong business, especially in medicine. You really need to kind of look at things and say, is this really going to do what it says? And so we're always a little skeptical. The old adage that I had in medical school was, don't be the first one to use the last drug, and don't be the last one to use the first drug. And it's kind of like, okay, you've got to find that middle ground. And I do think that as we get beyond this kind of stem cell fad, people will start to realize that there is really promise in the future of how these stem cells, these components of the stem cells called exosomes, how they will move medicine forward. I'm excited because I think we have another avenue for therapeutics that takes us off being dependent on just one medication or a medication to fix whatever ails us. Now, that doesn't mean medicines aren't appropriate. No, we shouldn't be using these things, because without insulin, we wouldn't have you here. So the point is we have to use them, but at the same time, can we reduce the amount that we're dependent on those drugs?
And how far, any idea how far the FDA is out to looking at this as a more serious light and getting approval on anything?
There's a handful of companies during COVID that were out there, and they had gotten into phase 1 and phase 2 studies. Some had gotten into phase 3 studies. They're still looking at efficacy. They're looking at safety. A lot of the drugs, or a lot of the companies that do this, one of them is Tony Robbins. You can just look up Tony Robbins' podcast. He talks about it. He has a book about his company, but they had been working in that arena for quite some time before COVID hit. And I think there's a significant amount of interest to try and see if we can utilize these stem cells that aren't from our own body, but from these perinatal tissue stem cells that aren't from, and we just need to define what that is. These are not embryonic stem cells. These are stem cells that were supposed to go to the baby that didn't, because they were still in the umbilical cord, but they were designed to be. So we're not embryonic stem cells. We do not need embryonic stem cells to do any of this anymore. So I think the first thing we should have pointed out is that what we're doing in the stem cell world, it doesn't require embryonic stem cells. We don't require a fetus to be destroyed in order to get those stem cells. And Dr. Yamanaka, who I talked about in the very beginning, the reason he won the Nobel Prize was he was able to identify that every cell in the body has the ability to go back to its embryonic state. That's a huge, huge advance in our understanding, because up to then we thought, well, once a cell started down a pathway, once it became a skin cell or an eye cell or a hair cell, that's where it was going to be. That was it. It was fixed. He identified that it wasn't fixed. You could take a cell and we can turn it back to its original embryonic state and then reprogram it to become a separate cell. So that's to me is probably that's the part that got me the most excited in about 2015 when I had gained that knowledge. So everything we're doing in this arena, I think, helps us move forward, but we're doing it the right way, and we're making sure that we don't get sideways with the FDA, that we're doing what we're charged to do. So, and I think the opportunities there are going to be grateful for the athletes and their families.
Well, and doing it right the first time, the right way, is going to benefit you more than rushing into it, like you said, upsetting the FDA or maybe not getting something right. And you don't want people to look at you in a bad light before you even get started. And I think you guys are on the path, and I'm excited for it, because I know we've talked about, once you get up and going, getting some in me somewhere to make me feel younger again. Make me look better. That's what I told my wife.
Yeah, but I don't think we're going to have you still wrestling right away until we make sure everything's fixed.
Yeah, right, exactly. When I talk to people and let them know the smartest guy I know, it's you right there standing in front of me, and I truly enjoy our conversations, because I feel like I learned so much that'll help benefit me and my family, and what you've done to help my family is incredible and really appreciated. My wife and I both appreciate it. Lonnie, I can't thank you enough. I'm excited for you to get your clinics up and running. And I
Yep.
know I'll talk to you often, but thank you for coming on the show, and thank you for educating these listeners on everything that you've educated me on.
Oh, you're welcome. Thanks, Luke, for having me. I appreciate it.
You bet. And we'll talk to you soon.